Hey, good morning, and welcome to our Thursday session of the Faith Forum. Thank you for being here. It's great seeing all of you. I know some of your professors have encouraged you to be here, and I think it's going to be worth your time, so I'm glad you're here. My name is Robert Gaudier. I'm the Executive Director of the Campolo Center for Ministry program here on campus, and delighted to welcome you all. Thank you, Dr. Modica, for the opportunity to introduce our guest speaker. Dr. Myron Glick was here yesterday for chapel. I'm not sure if you were able to hear that. It was a fantastic introduction of his work in Buffalo, the Jericho Road Community Health Center. I've had the opportunity of getting to know Myron over the last few years, and as I've learned about him, his calling, his mission, and his commitment to medicine and providing care to marginalized people in Buffalo and around the world. His story and the work of Jericho Road has reminded me a lot of the late Paul Farmer, and who was the founder of the Partners in Health, and fantastic work that was provided care around the world to marginalized and communities, and recognized work. And I just see the work of and commitment of Dr. Glick and Jericho Road as resembling that, and really privileged to have him on campus these few days and to share about that work. I want to encourage you, if you can, to attend the Conversation That Matters tonight. He'll be discussing a chapter from his book. And then tomorrow we have Windows on the World lecture and luncheon, also at 10 o'clock, and we'd be grateful if you came to that conversation and discussion as well. So Jericho Road Community Health Center is based in Buffalo. As I mentioned yesterday, he provided sort of the origins, the story of how he ended up in Buffalo after being born here in Lancaster County. He grew up in Belize, and it was his time there that really inspired his commitment to be a medical missionary doctor. And he went to medical school in Buffalo and settled there and began a family practice that has blossomed into this international agency that has clinics around the country and throughout Buffalo and around the world. And he'll be sharing about some of the particular work that's happening in Buffalo this morning. So please join me in welcoming our special guest, Dr. Myron Glick.
Good morning. The title of my talk today is Why Do Black Folks Die Young in America? Racial Health Equity, and What Does It Mean to Love Our Neighbor? So 2 things before I get started. First of all, if there's anyone really compulsive in this audience and you see that I'm not moving the slides along, it's not that I've forgotten. I just have one slide to show today, and it's at the end of the talk. And the second is, this is a very difficult conversation. It's not easy for me, and I suspect it may not be easy for some of you, maybe all of you, for different ways. This conversation may feel emotional. You may feel a sense of sadness or grief or anger. All that's normal. And after the conversation, I'm happy. If we have time, we'll give you a chance to ask questions. But I'm also happy to stay in the back and talk to you individually as needed. I thought I would start with the biblical story of Nehemiah. Nehemiah was born in Jerusalem, but early on in his life, Jerusalem was ransacked and destroyed. The walls that kept Jerusalem intact and its society intact were broken and battered and beaten up by the Babylonian Empire. And Nehemiah was taken to Babylon. And he grew up there, and he eventually ended up serving as the butler to the king. And I think for a moment in his life, he forgot where he had come from. He forgot maybe where what his people had been through. And he was serving with the king. But one day, a person from Jerusalem came, and Nehemiah heard him speak. And that person talked about the devastation that happened in Jerusalem, about the broken walls, about the way the remnant of the Jewish people that still stayed in Jerusalem were suffering. And in that moment, Nehemiah became broken. The Bible says he stripped off his clothes, he laid in sackcloth and ashes for 3 days, and eventually he got up and he acted. As I think about my life, and I would encourage you to think about your life, what are the Nehemiah moments that have turned me into being able to give this talk this morning? For me, and we talked about this yesterday, I won't go into it, but I grew up, I was born into an Amish family. I grew up in Belize, missionary kid, went back to Lancaster, did high school, eventually, long story, ended up at Houghton College, Christian liberal arts college, not that much different than this one. And my whole life, I didn't really understand the way the poor were treated in this country by our healthcare system, and I didn't really understand the way people of color had been treated by our country for all of this time. When I ended up in medical school in my 3rd and 4th year, I started doing rotations in the hospital. And I came face to face for the first time with the reality of the way the poor and people of color were treated by our healthcare system. I started Jericho. In 2005, there was a hurricane that swept through New Orleans, Category 5, and the levees broke. And you would think intellectually, if you just showed up in the world uninformed, that a natural disaster would affect people equally. But the reality was not that. I remember being in Buffalo, small family practice, and watching in horror that next week as mostly black folks were left on the rooftops of New Orleans buildings all over the city, especially in the lower 9th Ward. I remember the Superdome where the New Orleans Saints play, it being filled up with mostly black folks. And in the aftermath, we realized that disproportionately, the elderly, the poor, and people of color died. And why did that happen? Well, that's a long story, right? But there were systemic decisions that were made that ended up hundreds of years before that put black folks mostly in the places that would be most easily accessible to flooding, and so were disproportionately affected by that hurricane. In the COVID pandemic that hit 3 years ago, at Jericho Road, when it hit, we realized that we were afraid that the communities that we serve would be disproportionately affected by COVID. And so we rallied. We got testing units. We got treatment centers. We did everything we could. In the last 3 years, we've tested over 50,000 people. We've treated many people in the hospital. 20 of our patients have died. And what we've found in our data, despite our efforts, is that disproportionately, black folks were more likely to get sick from COVID, more likely to be hospitalized from COVID, and more likely to die because of COVID. This past winter, in December, on Christmas Eve, I am from Buffalo, and it snows in Buffalo, right? But this was not a normal snow. This started at 9 o'clock in the morning. It snowed straight, very, very hard. You could hardly see in front of you for 48 hours. The city pretty much shut down. No ambulances, no fire trucks, no police. And we were left all on our own. And in the aftermath of that storm, we found that 46 of our neighbors had died. Homeless people found on the street. People left frozen in their car because they had gotten stuck and the gas run out, and no one could rescue them. Elderly people in their homes when the power was cut off. And what we also have found out in the last couple of months is that the majority of the folks that died during the blizzard in Buffalo were black and brown. I think it was, well, I know it was after the George Floyd brutal murder by the police, that there was this national push to reevaluate what are the issues, the systemic things that are in our society that set people up, black folks up, to die young. And I've witnessed, right? I've been a doc at Jericho for almost 27 years now. So I've seen this, and I know it to be true. But after George Floyd, I decided to do what I could, which is to study to find out, to dig deeper. Why is this happening? I mean, I see it happening, but why is it really happening? And this lecture today is really something that's been germinating and percolating and building up in the last 3 years as a result of that. As a family doctor, I've worked for the past 26 years in communities in Buffalo that are broken and beat up. As a follower of Jesus, I have recognized that much of this brokenness, is rooted in the 400-year history of racial inequality in this country. Today, I want to talk honestly about what I've witnessed and what we need to do about it. The basic inequity is that black folks die younger than white folks, much younger. Nationally, the life expectancy is about 5 years different. In Buffalo, it's about 10 years. Black folks are more likely to die from stroke, from breast cancer, cervical cancer, heart disease, diabetes, HIV, AIDS, COVID. They have increased risk of dying during childbirth, and their babies have an increased risk of dying when they're born. This racial health gap in the United States is estimated to cause at least 84,000 deaths every year. So why is this happening? And that's the crux of what we're going to talk about this morning. First, I need to be clear about what is not the cause of these differences. It's not due to genetic differences. You can't look at our DNA and tell that one of us is black and one of us is white. It's not due to individual behaviors. Individual behaviors only determine why I am the way I am. It doesn't determine for a whole group. It's not due to faith or religion gaps. The real reason is structural racism. Where racial inequity is found, anytime you see a gap, then that means that structural racism exists. That's the reality of this country. It's what causes the inequity. It's the attitudes, the rules, the systems that cause the disparity in the first place and that keep them alive today. To understand this, we need to talk about something called the social determinants of health. These are the conditions in which people are born, they grow, they live, they work, they die. Things like education, income, employment, race, the zip code you were born in, family and social support, air quality, water quality, exposure to the criminal justice system. One of the humbling things that I've realized and that the experts tell me as a doctor is that health, if you define health not as the absence of a disease, but this idea of health and well-being, that only 10% is based on the medical care that I give. 10% is due to genetics, but 80% of health is related to the social determinants of health. In a way, this is maybe an example to sort of get at it. I am a family doc. I've delivered babies the last 27 years. I've delivered thousands of babies in Buffalo. And for the most part, when the baby comes out, they're kind of bloody, slimy, you wash them off, you clean, and they're beautiful little babies, right? And they all kind of look the same to me, for the most part. But then I also have the privilege of being their family doc as they grow up. Some of them have grown up to the point that now I'm delivering their babies. So I've had a long-term relationship. And one of the saddest things, sadness, grief for me, is that they don't turn out all the same. and you see the struggles. You see the effect of the social determinants of health in the lives of these little babies who grow up in Buffalo, on the west and east side of Buffalo. It's my belief that the racial health disparities that I've witnessed daily at Jericho Road can primarily be explained by understanding three social determinants of health that especially affect African Americans: racism, poverty, and residential segregation by zip code. I want to start with the story of Cynthia Wiggins. When we moved back to Buffalo to start Jericho that year, there was this devastating thing that happened in Buffalo. Cynthia was a young black woman who lived on the east side of Buffalo, where most African Americans live in Buffalo. She had a one-year-old son. Her mother was neighbors to where Joyce and I lived. She lived on the east side of Buffalo. She took a bus every day to about 30 minutes away to a mall in the suburbs that was affluent, sort of high-scale, upscale mall. And one December day, it was really snowy. There was big snowbanks. And as the bus dropped her off, she had to walk across a busy intersection to get to the mall. And as she was walking across the street, a dump truck came, turned the corner, didn't see her, and she was killed instantly. And the way the Buffalo News took it and the way the community at large took it, it was a tragedy, right? A young woman dies suddenly on the way to work. But her family knew better. They hired a famous attorney named Johnny Cochrane, who had been the attorney for O.J. Simpson. And as they knew that, and what they found out in their investigation was that buses that came to this mall from Canada were allowed to drop their folks off at the front of the mall. And that buses that came from other suburban areas in Western New York, they were able to do that. But the buses that came from the east side of Buffalo had to stop outside the mall across this busy street and drop their passengers off. And so they did a deposition, and they found that the Buffalo bus company had been every year for the last 8 years begging the owners of the mall to allow their passengers to be dropped off at the front like everyone else. And they were denied 8 years in a row. And when we got the owners on the deposition stage of the trial, the owner actually said, yes, I agree, we did not do that because we wanted to keep inner city crime out of the mall. Needless to say, they lost the case, and Cynthia Wiggins' family got a big settlement. But you could also say that that systemic rule about the buses is what caused Cynthia's death, and that systemic rule is founded on the idea on racism. Medicaid and the formation of Medicaid and Medicare is another classic example. And I can draw a line between that and why black folks died so much during COVID in New York City. So in 1964, the Congress passed the Voting Rights Act and the Civil Rights Act. And there is this big push to also create a national health care plan for everyone. I mean, medicine, prior to that, people had been pushing for better care, because basically what was happening as medicine was growing is you either had to pay for medical care or you would have private insurance. Insurance companies were starting to found. But the poor, people who couldn't afford that, were left behind. And so the push was to have this national plan that would take care of everyone. The problem was the opposition came from the Southern senators and congressmen, people. Because what was happening up until the mid-'60s is that, especially in hospitals in the South, medical schools, clinics, health centers, there were plenty of places that refused to allow black folks to be treated. Whole medical schools like Emory University, whole hospital systems that did not allow black folks to come in. And they knew that if the government, the national government, created this one national plan, it would force them to integrate. And so they came up with a fatal compromise. And the compromise was, let's form Medicaid and Medicare. Medicaid is still in existence today. We take care, 80% of our patients at Jericho Road in Buffalo have Medicaid. Medicaid is the health care plan for the poor. 60% of the people on Medicaid are people of color. The states, individual states manage. So New York State can have a whole different benefit system than, say, Mississippi. Hospitals can choose to opt out. Doctors can choose to opt out. And the fee schedule is not that great. Medicare, on the other hand, was the healthcare system for the elderly. 80% of elderly people over 65 on Medicare are white. The federal government manages it across the board. There is no state variation. The benefits are the same. All hospitals and doctors have to accept Medicare, or they completely have to opt out of the insurance system. And it sets the standard for reimbursement. The New York Times, at the beginning of COVID in New York City, and New York City got hit harder than any other place in the COVID pandemic. I mean, in the months from March till end of April, 25,000 people died. The hospitals, well, we'll get to which ones, were overflowing. The morgues were overflowing. They had to bring tractor trailers with coolers in to hold all the bodies. The New York Times put reporters in the public system, hospital system, and the private hospital system in New York City. And they found that the public hospitals had a 3 times greater mortality rate from COVID. They concluded their study, which they published that July, that in New York City, surviving COVID might have just come down to which hospital we were admitted to. The problem was, and this goes all the way back to 1965, the public hospitals mostly served 90% of their patients are uninsured, people on Medicaid, black and brown folks. Elmhurst Hospital would be a classic example. Whereas the private hospitals are the ones you guys know about. Maybe someday you'll be medical students and you'll go to Mount Sinai or Albert Einstein or Columbia Presbyterian. They mostly serve wealthy, white, privately insured folks. I think 10% are uninsured or Medicaid. The public hospitals were completely understaffed, completely overwhelmed. ER nurses were taking care of 23 patients for one nurse, whereas in the private system it was 4 to 1. In the ICU, one nurse was taking care of 8 ICU patients, many of them intubated. In the private system, it was 3 to 1. It was so bad on the public side that patients were pulling their tubes out and wandering the hall, and they even had a name for people that coded and were dying in the hallway because they just couldn't get to them. They had decreased access to kidney dialysis. There were no heart-lung bypass machines. They didn't have access to clinical trials at that time of remdesivir. Private hospitals were good with all that stuff. They had the latest equipment. Public hospitals had old ventilators. And it got so bad that the regular doctors at the private hospitals were begging to get patients, right? They were begging for Cuomo and the state to transfer, and their hospital administrators to transfer patients because they were sitting around doing nothing while the public hospitals people were dying like crazy. In this whole time, only 50 patients were transferred from public to private systems. And the basic reason is because the hospital administrators knew the financial consequences of that decision. Black folks have access to less quality care. They're more likely to be uninsured or on Medicaid, which makes it harder for them to access care. There was a national survey of family doctors in 2015, which showed that 45% of the doctors surveyed across the country were willing to accept new Medicaid patients. 95% were willing to accept new private insured patients. In 2017, the CEO of Mayo Clinic was caught offline, like a hot mic sort of moment, where at a conference he said that Mayo Clinic prioritizes the care of privately insured patients over those on Medicaid. Black folks are more likely to live in areas that have few health centers. due to long-standing residential segregation, black folks are more likely to live in areas that are a food desert or that don't have offices or health centers, et cetera, et cetera. The medical training of students and residents relies disproportionately on the use of poor communities of color. There was a book in 1982 that Paul Starr wrote called The Social Transformation of the American Medical System, where he argues that American teaching hospitals were deliberately built in centers of urban poverty so that students and residents would have access to patients to learn from. I had a classic, it's not the only time I've heard this, but a couple years ago I had a patient who I knew needed outpatient cardiology care, needed what's called an angiogram. Didn't have to be put in the hospital. I called one of the cardiologists that works with us, that we send patients to, and I told him the story, and he agreed. And then he paused, because I thought we were all set. And then he paused, and I think because he knew it was Dr. Glick in Jericho Road, he said, "What insurance does this patient have?" And I said, "I think he has Medicaid." And he said, and I'm not kidding, he said, "Dr. Glick, why don't you send them to ECMC where my residents can have someone to practice on?" Black folks are often treated by white doctors who have bias. There's been a number of good studies in the last 10 years that have shown this. Black ER patients are 22 less likely to receive pain medications. There was a 2016 study of 220 white residents and medical students. In answer to a whole series of questions, one of the questions they answered is that they thought that black people had thicker skin and could tolerate pain better. There was a study in 1932, the Tuskegee study of untreated syphilis in the Negro male. It was funded by the U.S. Public Health Service. There was no informed consent. These men were never told they had syphilis. They never got the treatment for syphilis, which is curative. It was penicillin. These poor black men from Macon County, Alabama, were recruited to watch them die. Most of what I know today about syphilis comes from this study. And you could say, well, that was 1932, Dr. Glick. We're different now. But the problem is, it's something that the way black folks were treated in that study is something that is still well known in the community today. And it's often cited by my patients when they refuse to get an intervention that I recommend, like, say, a COVID vaccine or a flu shot. It is still one of the reasons that many do not trust our system today. Another systemic thing is, how does the MCAT keep black Americans from becoming doctors? Those of you that might want to go into medicine someday, you know that one of the mountains you have to overcome is do this test called the MCAT. The problem is that only 6% of our doctors today are African American, even though African Americans make up 14%, can you guys hear me? 14% of the population. This gap is caused by structural racism, and this gap directly affects the quality of the care that black folks get. Compared to white children, black children, the median family income is $17,000. They have increased risk of being hungry when they grow up, as they're growing up. Increased exposure to lead levels, increased exposure to single-parent homes, more likely to attend substandard schools that do not offer AP classes and that do not have college advisors, or even, there are high schools in Buffalo where there are no guidance counselors. Keep in mind that the major source of local funding for public schools comes from property taxes. So when you have housing equality, like we're going to talk about, that leads to educational inequality. And so that you get kids that come to take the MCAT, and they're not maybe ready. They haven't had the opportunity. My feeling is that the MCAT does not measure aptitude or intelligence or potential, What the MCAT measures is opportunity. And we base admission to medical school based on that. And it's not fair. And it sets us up for failure. The second structural social determinant of health that makes a huge difference to explain why black folks die young is poverty. Now, poverty is a powerful social determinant of health. The life expectancy gap between the richest 1% of us in America and the poorest 1% is 14.6 years. It's been said and proven that being poor is worse to your health than a lifetime of smoking. Poverty often forces people to do the following things: live in communities without access to healthy foods and good health care and green spaces, live in substandard homes with increased lead, factories, highways, and garbage dumps, attend substandard schools, ride 2 to 3 buses to get to work because they can't afford to buy a car, live in high crime communities, struggle when exposed to the criminal justice system, don't have money to pay an attorney, get a public defender, just sit there where if they had money they wouldn't be there. There's no question that being poor is very bad for your health. But because, and here's the thing, because of a 400-year history of slavery and racism, black folks are much more often poor than white folks. Black people own just 3% of the wealth in the United States. The median family wealth of a white family is $171,000 in this country, compared to $17,000 for a black family. In Buffalo, 49% of black children live in poverty, compared to only 10% of white children. The third social determinant of health that makes a huge difference in why black folks die young in the United States is residential segregation by zip code. The zip code you were born in is a much stronger predictor of your life expectancy than your genetic code. In Buffalo, I live in zip code 14214. The life expectancy, if you're born in that zip code, is 78 years. One of the offices I practice medicine out of, zip code 14211, the life expectancy is 71 years. In New Orleans, there are zip codes that have a 25-year gap in life expectancy between certain zip codes. It is not the actual zip code that causes the difference, but rather it's the residential segregation by race that is the problem. In a country as intentionally segregated as the United States, zip codes are merely a proxy for race. Our nation is geographically divided by race. Black folks were historically restricted to neighborhoods separated from white folks by railroads, highways, rivers. These stark boundaries or barriers between communities and neighborhoods have played a major role in walling off communities, reinforcing divides, and physically isolating black folks from schools, parks, and their white neighbors nearby. In Buffalo, 85% of black folks live on the east of Main Street. In Pittsburgh, the communities are divided by a series of railroad tracks. In Tampa, it's Route 275. In St. Louis, it's divided by a 4-lane boulevard called the Del Mar Divide. In Washington, D.C., it's divided by a park and a river. In Detroit, it's divided by a road. I knew I was going to speak in Philadelphia. I don't know Philadelphia well, but I believe that about 80% of black folks live in the northern parts of the city. Why is this so? So why is there residential segregation? It's not an accident. There's a number of factors. So one of the things that happened in our country is the great migration of black folks fleeing the Jim Crow South as refugees, basically. Between the years of 1915 and 1970, over 6 million people moved from the South to the North. But when they came to cities like Buffalo or Chicago or Philadelphia, they were forced to live in separate parts of the city. South Chicago, East Buffalo. And if they chose a different path, there were riots, they were killed. There was a series of racist, systemic actions that were made in reaction to black folks coming to the North that still reverberate today. Redlining would be probably the most egregious. The federal government, it's unbelievable. They basically came up with this map that looked at cities and divided cities into 4 categories. A is a category that banks would be encouraged to invest a lot of loans, a lot of resources. D were marked as hazardous areas that had undesirable populations of African Americans, immigrants, and Jews. Every African American community in urban areas of the North were rated as a D. And it wasn't just that then money didn't flow from banks and the federal government, it was that the private sector and everyone else took that cue also. I don't have it on the screen because I really wanted to focus. I have a lot to cover. But I could show you a map of the redlining that was done in Philadelphia in 1937. And I could overlay a map of where African Americans live today in Philadelphia. And those maps are almost the same. I'm going to talk about something that's a little off, not in my notes. But in May of this past year, there was a horrific incident in Buffalo where a young white man grew up in the suburbs of Binghamton, which is just 3 hours away. He went to church. He went to the public high school. But in May, he decided that, and he wrote a manifesto, so we know this, 180-page manifesto. And what he said was that he wanted to find the place that had the highest concentration of black folks, and he wanted to kill them. And so he did. He came to Buffalo, to the east side, to the one grocery store for the whole east side where 85% of black folks live. And he walked in to that store and he started shooting. And he killed 10 people. He passed by white folks and didn't kill them. Most of the people that died were elderly because they couldn't hide, couldn't run. And I think we like to think maybe that this was one racist guy who did a really bad thing. And I'm not like that. That's not me. It's not on me. But I think you could maybe draw a line to the redlining of the 1930s that created a community on the east side of Buffalo filled with black folks. And many other decisions and attitudes that we as a country, white folks, have allowed to stay a part of our lives that would make me to believe that white folks in the United States are as responsible as that 19-year-old for what happened in the Tops on May 14th. Even when the racist real estate actions were made illegal in the 1970s, housing discrimination has continued. And one of the crazy things that happened when these laws were changed in the 1960s, 1970s. Schools were forced to integrate in our cities. Then what happened? White folks decided to leave the city. In Buffalo from 1970 to 1990, 50% of the white population fled Buffalo to the suburbs. And one of the other crazy things is the Federal Housing Association, the FHA, federal program provides loans for people to buy houses, made it really, really easy for white folks to get loans to buy houses in the suburbs. Residential segregation causes poor health because it confines poor black folks to live in neighborhoods that have substandard housing, low functioning schools, decreased access to health care, et cetera, et cetera, et cetera. Sometimes as a doctor serving these communities, I wonder if the best health advice I could give the families I see there is to get the hell out of this community. The available data would support that advice. So what can we do? What would Jesus do? I'm going to show, first of all, let me say clearly, I believe that we, individuals, organizations, communities, our nation, need to preferentially invest in our collective resources to those who have historically had the least opportunity. We need to promote this idea of equity as our guiding principle in decision making in order to truly love our neighbors and to do what Jesus would do. I want to show you this one slide. I think my computer, I'll figure it out. So the reality is that the odds are stacked against, right? That's what the reality is. If we equally decide to do stuff, we still have inequity. The answer is, at least in the short term, before we remove all the barriers long term, is we have to preferentially invest, and that's what equity is. I'll give you two quick examples. This latest blizzard that happened in Buffalo. I believe our leaders, our politicians, the people in charge of our state and our city should have realized that if there's a once-in-a-generation blizzard bearing down on Buffalo, that the people who are going to be hurt the most are poor folks and communities of color. And they should have invested resources, snowmobiles, plows, the fire department, people who fix electric on the east side of Buffalo before the storm. That's how you do equity. And it's not, there's many other things that have gone into why folks died during the storm. But if you're a leader, instead they treat things equally. At Jericho Road, we try to take this as a principle. One of the things that we do in trying to prevent black moms from dying during childbirth is we have doulas, and we invest heavily in folks that we think need our help the most. We look at all our diabetics, we look at how they're doing, and we take the ones who are doing the poorest and we pour our resources into that group. We have to, whether it's at Eastern College or in Buffalo at Jericho or as a nation, have to figure out ways to preferentially invest to make up the imbalance. I love what Nehemiah said, or the story of Nehemiah. You know, the way Jerusalem was rebuilt and the walls were put back together again, there's a whole chapter. It talks about this family did this gate. This family did this gate. We all need to do our part. I'm going to stop there. I've said a lot. We have a few minutes. If anyone has a question or a comment, as long as you don't go on as long as I did, you would be welcome to ask that question. But stand up and make sure you speak clearly. In the back. That's a good question. So one of the things that I've done over the last 3 years is draft a manuscript, and one of the chapters is this. So if would love to get that book published. I would love to do this chapter as an article. I've thought about that. Most of the time, I'm a doc busy seeing patients, and so it's a challenge to get this stuff published. But I do believe that it's important that we understand the root causes of what we're dealing with today. Other questions? In the back. With regards to health, trying to get health care for everyone? Well, again, I mean, I think I've said this in the past, and I mean, it's not unique to me, but I believe that the number one reason why we don't have a national health care plan that treats everyone, gives everyone an insurance card like our chaplain has in his pocket, is racism. That's what happened in 1965. That's what happened in 2008 when the Affordable Care Act was passed. One of the things that happened with the Affordable Care Act was Medicaid expansion, to try to get Medicaid to many more people. But states were allowed to opt in. And the states that have chosen to opt out of that expansion are mostly southern states. And the people who were opposed to the Affordable Care Act were mostly coming from southern states. So I believe political activism is important. I believe as an individual we should vote, and we should try to get, at the end of the day, whatever I say here doesn't make a difference unless we change the system that we live in. So I can do charity, and we do it at Jericho Road. It's important. We should care about the suffering that we see in individuals. But unless we change the system, you're young. You know, I used to say in my lifetime, we'll see a day when everyone is treated with health insurance across this country. I don't know if that's going to happen anymore, but maybe in your day. So we should be passionate about changing the system. That's the most important thing that you can do. And we constantly fail to see it that way. We feel good about our acts of charity. It's not enough. Other questions? Mm-hmm. 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 Yeah, I mean, in the 1960s, one of the things that came out is, in a way, a civil rights part of the civil rights movement. We started the community health center movement across the United States, and so we're one of 1,300 community health centers that the federal government is investing and paying better for Medicaid, and so that's the main way that we sustain ourselves. We see, 130,000 visits a year across 5 health centers, and what we do is important. But someday, we want to see the system change. It's not enough. I think you guys have to go to class. I don't want to keep you too long, so thank you for your attention.